Okay, today's webinar is brought to you by Health Network One, who's an MHPA partner, a longtime supporter of MHPA and our health plan members. We thank them for organizing today's presentation. The future of specialty care is value. And with that, I'm excited to turn things over to KG, who serves as Chief Growth Officer of Health Network One. KG?
Thank you so much, Patrick. Hi, everyone, and thank you for joining us today. We're so glad that you're here. We're here to share more about how value-based care can dramatically change your provider relationships and drive savings in therapy. And you won't just hear from us today, but you'll also hear from Cora, a provider in therapy as well. My name is Kristen Gastizzaro, as Patrick said. Everybody refers to me as KG. I'm excited to have my colleagues and esteemed panel members, Dr. Kel Riley, our Chief Medical Officer, and Martin Bilowich, a strategic advisor and founder of Health Network One with deep experience in therapy solutions. We are also joined by Tom Austin, who's the Senior Vice President of Strategic Finance from Cora Physical Therapy. Tom, could you please provide a brief introduction?
Sure. Thanks for having me. So at Cora, I lead all of our payer relationships, including our value-based care strategy and how we think about working with payers on that, and also have deep experience in our payer operations. So understand how these things impact our clinic at the full scale.
Thank you so much, Tom. We're so glad that you're here with us today. So before we jump in, I want to share a brief overview of Health Network One. We are the recognized leader in specialty care with a mission centered on delivering better outcomes for members, providers, and plans alike. We operate like a health plan within a health plan, taking full accountability for a value chain between the plan and its providers, delivering up to 40% annual savings in the specialties we manage. Our fully delegated model means that health plans can take a hands-off approach, confident that every operational and clinical detail is managed for performance, savings, and member and provider satisfaction. Everything we do is reinforced through clinical programs and medical policies that guide providers towards outcomes-focused care and through value-based payment models that reward performance, not volume. Providers are engaged, supported, and recognized for best practices, creating a true partnership that benefits everyone involved. In short, our integrated model aligns health plans and providers in one seamless system, frictionless, outcomes-driven, and proven to deliver the measurable savings year after year. With more than 7 million covered lives, a network of more than 30,000 providers, and operations across 41 states and in Puerto Rico, Health Network One delivers scalable, high-quality specialty care with broad accessibility. This foundation allows us to support our health plans in transforming specialty care, bringing value-based strategies to disciplines that have long been left behind. So when most people define specialty care, they picture the highest cost, most complex clinical areas. Think cardiology, oncology, neurology. And while those are certainly critical to manage specialty care actually encompasses any service that's delivered outside of primary care. That broader definition includes a range of high-impact specialties that are often overlooked, such as outpatient therapies, which includes physical therapy, occupational therapy, and speech therapy, dermatology, eye care, sleep, and more. Many of these rank among the top 20 in healthcare spend, yet they are frequently misunderstood, misused, or treated as an afterthought. These specialties are particularly vulnerable to overuse and inconsistent care, which drives up costs and creates confusion. Today, our focus, as I mentioned, will be on therapy, where there are significant challenges within this discipline that often include attempts to control costs with high denial rates of greater than 20%, reducing the provider reimbursement, and narrowing the network, often exacerbating an already challenging situation. When delivering a service like therapy through a value-based model, you can expect to see 15 to 30% administrative and clinical savings without compromising provider or member satisfaction. And with peer-to-peer clinical oversight, value-based reimbursement, and measurable outcomes, that achieves less than a 1% denial rate and 98% provider satisfaction, ensuring high quality, lower cost musculoskeletal care. These are the core attributes of our Thrive Therapy solution that we will dive deeper into today. However, before we do that, Kel, can you please share more about the rising costs in healthcare that we're seeing today?
Thanks, KG. We're experiencing some of the highest trends in healthcare costs seen in recent memory. In the 15 years from 2008 to 2023, per enrollee spending by Medicare grew more than 50%, and per enrollee spending by Medicaid grew more than 30%. There are several factors that have contributed to this, including an aging population, increased prevalence of chronic illnesses, and costly but useful breakthroughs in medical treatments and technology. With a forecasted medical cost trend as high as 8.5% next year and ongoing reductions in federal spending, health plans will continue to feel this strain. Tom, are providers impacted as well?
Absolutely. Yeah, we're seeing this across the board, across increased wages from therapists, which you can see in data from places like the BLS, where those wages are growing every year, as well as just general costs for operating our clinics. And as you noted, there's just increased utilization as well, due to aging population and other factors. So we're definitely feeling pressure on our operations every day.
Thanks, Tom. While national healthcare costs continue to rise, the picture becomes even clearer when we zoom in on specific disciplines like therapy. Let's use an example sourced directly from a health plan challenged by managing therapy costs and plan margins. The data reveals how therapy utilization and costs have evolved in a real-world setting. These are some of the variables that affect rising therapy costs. In a fee-for-service model, there's no real incentive to manage to the right care plan because the system quietly rewards more visits, not better results. That often means overutilization and the potential for fraud, waste, and abuse. In this real-world example, you can see that the cost per visit has increased only modestly over the last 5 years. However, the number of visits per member has jumped 41%. What's really driving this, though, is the number of cases per 1,000 members, which has shown a 66% increase over that time. These factors continue to drive up therapy costs. In fact, those variables have caused therapy costs to skyrocket, and it's not because of the fee schedule or market demand. Instead, as we have shown on the previous slide, it's due to more visits per person and more members needing care, which has caused payments per case to increase 44%, and per member per month costs to escalate substantially. I'm now going to turn it over to Marty to explain how traditional therapy management has led to this scenario. Marty?
Thank you, Cal. As Cal mentioned, as the costs have shown to continue to increase so dramatically in therapy, health plans are obviously trying to find ways to implement various managed care tools in order to try to manage these expenses. Unfortunately, none of these tools that have usually been implemented have had a profound impact on over long-term cost management. And also, they tend to offer and result in negative outcomes also taking place when they're implemented. For example, probably the most common cost-saving initiative to manage therapy is implementing a heavy program, which creates hurdles for approving and authorizing services. This is done either internally or through an external outside company that performs ASO services. These programs almost end up not really succeeding, mainly because the problematic providers that are creating a lot of the escalated costs will find one way or the other to eventually get all their requested services approved. In addition, this is a very expensive program to administer, both for the health plan and for the providers in order to comply with these requirements. And especially given how long typical therapy cases last and how many visits are need to be reviewed for each particular case. Lastly, this type of program often results in delays in care for providers waiting for their authorizations to be approved, creating both frustration on the provider end and on the members that they're treating. Another option for managing therapy has been to reduce the overall provider network size. But this initiative can create access issues and also creates quite a bit of member frustration and complaints, not being able to access providers as readily as other plans would be available. The last option is sometimes to reduce the overall reimbursement for all therapy providers in the network. However, doing this punishes both the good utilizers and the bad utilizers in the network. And often the problematic ones will just find other ways to enhance their revenues, either by billing more units per visit or more visits per patient. And in turn, any kind of savings is negated. It's for all of these reasons that we have a solution that does truly try to manage costs, but doesn't incur these other problems of limiting provider access, delay in care, increased administrative costs, and member frustration and complaints. And the solution is found by instituting a value-based program rather than continue to reimburse providers on a fee-for-service basis. Although value-based care is more commonly utilized in primary care and large health systems, it often can work well for therapy as well and other single specialty networks, and really for all lines of business. So we're going to explore how value-based care models are able to create this paradigm change in therapy. When looking at therapy, it offers one of the clearest opportunities to implement a value-based care program. One of the main reasons for this is because there's such a great variance in utilization patterns from one provider to the other, even if they're being reimbursed at the same reimbursement level. This variance can result in 2 to 3 times higher of a cost per patient with one provider versus the other, and even if they're being compensated and if this is being done on a fee-for-service basis. One of the other reasons there's that opportunity in value-based for therapy is because there is a large supply of providers typically in most market areas, and there's other ample ones to be able to contract and that are open to having an open model such as value-based. Lastly, on therapy, most providers in therapy provide a homogeneous set of services, meaning there's not one particular provider you just absolutely have to have in the network to perform certain medical services. But besides for the cost savings that value-based provides for a plan, there's other enhancements that also end up being available. You have improved patient outcomes, you have enabled more streamlined plans of care, and reducing unnecessary costs, both medically and on the administrative side, and both for the health plans and for the providers. This slide shows an example of just some of the key focuses, what tends to be from a provider's end when you look at fee-for-service versus value-based care in arrangement. In fee-for-service, you can see that the typical focus on the provider is on quantity, asking for the maximum allowable visits many times, and focusing on that as the outcome. And they're often frequently rewarded then for having a higher volume rather than focusing on quality and outcomes. In value-based, there's a focus more on delivering the best care most effectively that can be attainable for the member. And in value-based, it creates an automatic continuous improvement focus from both the provider and from the health plan, and rewards quality for the providers that are able to provide the highest quality outcomes in the most efficient manner. That's one reason why underneath our value-based program, when a provider does contract with us, we've been able to maintain a 98% provider retention rate for providers that join our network.
Great. With that, we're going to put a poll up and would love to get your insight. Has your plan adopted value-based care and specialty management? Yes, and it's going great. We tried, but it didn't work for us. We're considering it, or no. We'll give you a few minutes to answer, and then Patrick will show us your responses.
All right, great results so far. Keep them coming, folks. Okay, going once, going twice. Go ahead and share those results.
Great. So the results of it are, I hope you can see this, 20% say that it's going great, 60% say you're considering it, and roughly 20% say no. So hopefully that is helpful insight and interesting. Marty, any comments from your seat?
Yes, I would say I think when we work with many major plans, at least in one market, and I think this is pretty reflective of what we've seen regularly in the industry. I think on the specialty management, there hasn't always been a lot of value-based yet implemented, but there is a consideration for that, given that it probably might already be in place for specialties, as we mentioned, like primary care or in large health systems. So it is something I think health plans are recognizing a need for, but just are not sure yet how to maybe implement and replicate any value-based arrangements they already have in place with other types of providers.
Great.
On this slide, it sort of shows how the key focuses for value-based for all different entity parties that are involved, the payers, the providers, and the members. You can see on value-based, the incentives are much more aligned between the health plan and the provider. The health plans want to pay for measurable outcomes to lead to immediate and long-term cost savings. And for the provider, value-based care allows them to focus on improving the patient's health in a manner that they see best. And it's a model that supports innovative care delivery, such as at-home treatment protocols, telehealth, or varying the treatment times and frequency on a patient-by-patient basis. One story I could provide for you, real life, that we realized when we were entering into a new state, and we were meeting with the different therapy associations in that state. We met with one of the lead of the Occupational Therapy Association, and she was very versed in value-based, and she mentioned that she really embraces value-based. And part of it, from her perspective as a provider, was that in typical authorization mode and with health plans and fee-for-service, you're given a very fixed authorization process, maybe 2 times a week for 30 minutes for 60 days. And what she observed, though, is that doesn't always fit, that cookie cutter doesn't always fit with every patient she needs to treat and how best to treat them to get them to their outcome as efficiently as possible. For example, she said there could be a patient that she'd want to see for an hour at first, and then maybe another hour the second day, and educate them and let them provide some tools at home to work on and have a periodic visit back with her, or maybe even a telehealth visit. But according, listening to her, that type of arrangement would not be allowed or permitted in a typical traditional fee-for-service authorization model. Instead, she has to follow the rules or else either not get paid for extra work that she'd be doing in order to accomplish what she thinks is best for the patient. But the end result in value-based care is a win-win aligned incentives between the payers and the providers. And in turn, that's what ends up resulting in the best outcomes and best results for the members that they treat. Kel, can you explain a little more about the Health Network One model and how it works?
Thanks, Marty. So there's tremendous opportunity to better manage specialty care through value-based models. In the case of outpatient physical, occupational, and speech therapies, episodic care strategy is one especially effective option. We'll explain how it works and discuss how value-based care has worked with one of our network partners, Cora Physical Therapy. The Health Network One model was designed by experts in the field. We rely on widely accepted standardized assessments and evidence-based treatment guidelines. Most of the time, we and our providers agree on functional impairment levels. But if there is any question, we conduct therapist-to-therapist peer-to-peer reviews to reach an agreement on a starting impairment level. We then partner with our network providers to monitor therapy goals and adherence to care plans. With this model, the optimal care plan is rewarded rather than the longest and most costly one. The results of this process are the best and most affordable outcomes for plans and their members. Reimbursement is provided for an episodic care tied to impairment levels, which are determined between the ordering provider and Health Network One. Instead of paying for each visit, our model reimburses for services provided during that episodic care, which again is tied to an initial impairment level, thereby ensuring fair, outcomes-driven payment. This strategy benefits health plans and members, mitigating the upward trend in therapy PMPMs and reducing costs. The vast majority of our providers in our model have found that the reimbursement they receive is appropriate, while a small group of those providers accustomed to fee-for-service and the inherent overutilization that encourages have found that they are paid less.
Great. We have another poll that we're going to put up. So we'll get that going. Let me read that. What are your biggest challenges in managing specialty care? Rising costs, overutilization and inappropriate care, limited provider networks and access, that's all one, administrative burden, meeting quality measures, or other.
All right, a lot of good responses coming in. Still got some coming. Okay, going once, going twice. Let's share the results.
That's great. So interestingly, pretty even in some across the board. 24% of folks felt rising costs, 20% on overutilization and inappropriate care, 16% on limiting provider network access. The administrative burden makes up 24%, which is not altogether surprising for us, given that health plans often aren't built necessarily to manage these specialties. Meeting quality measures was 16% and really no others. So this aligns with what we hear often from our health plan clients, but probably resonates with all of you as well. All right. So Cal, thank you so much. We're going to take a step back from the presentation, but before we do that, and do a Q&A with Tom. But before we do that, I would love for Tom to share more about Cora.
Sure. So Cora is one of the 10 largest outpatient PT/OT chains in the country. We have about 250 clinics stretching across 10 states from Wisconsin down through Florida, with Florida being our largest concentration of states. We have almost 1,000 clinicians now, treat over 200,000 patients a year, and we've been doing this for about 25 years.
Great. Thank you. All right, I'm going to stop sharing, and we'll be pinning both of our speakers up. So we'll give it a minute here. Great. I think we're good to start, Kel.
All right, thanks. Tom, I have a series of questions I'd like to pose to you. The first one is, can you tell how Cora started in value-based care?
For Cora, it really came about as necessity. So at Cora, we're really trying to treat just as many patients as we can. And we also grew up in Florida, where there's a strong culture of value-based care. And so in that environment, if you want to take all patients, you almost have to be able to operate under this paradigm. And so from early days, the company got into it, and it's been very successful for us.
Thanks. Next question. Did Cora have any concerns when entering into value-based care?
I think that there's always things we need to look at when entering into any agreement with any payer, especially if it's a new reimbursement model. For us, like I said, the goal is always to see as many patients as we can and deliver care to as many patients as we can. So we're always trying to make it work. I think what's key for us is having good partners on the other side who can help us make it work and make sure we get the operations right, the technology right, and so that the care ends up where it needs to be.
Okay, thanks. Why do some providers in your specialty not embrace value-based care arrangements as much as Cora has?
I think there's a couple things here. For one, the industry, PT/OT industry, continues to be very fragmented. And so you have a lot of small 1 or 2 clinic operations out there that are really mom and pop type things. And in those clinics groups, it's very hard for them to focus on anything more than the day-to-day and trying to get through every day. And so to adjust their operations and technology to do that, that's very challenging. For a company like Cora that has a level of scale, it's a little more possible. And as you see the industry continuing to consolidate, I think you're going to see more adoption. The second thing I would say is you do have to adjust your processes, and that requires some level of innovation. It can be a little bit difficult if you're using an out-of-the-box EMR. At Cora, we have all our technology homegrown, so that gives us a bit of additional flexibility. But adjusting the operations is something that every group has to deal with.
Thanks. So how much of your business is under value-based care versus fee-for-service versus some other reimbursement model?
Sure. It varies by region a lot, and I think that's probably not a huge surprise to anybody. In Florida, especially South Florida, that's where we have the highest penetration, and in some other states, it's a lot lower. But overall, it's still very small across the whole company. It's less than 10% where we're being paid in something other than kind of a pure fee for service. But we do see it growing, and we're constantly looking for more partners to grow that model in and outside Florida.
And from a provider perspective, what do you perceive as the biggest benefit of participating in a value-based care arrangement?
Yeah, like I've said, the goal at Cora is to treat as many patients as we can. And we sort of hit, I know folks hit on it earlier in the webinar, but there's just not enough capacity in the industry right now from a supply of therapists perspective. And so we need to get creative in how we're going to treat as many patients as possible for as efficiently and cost effectively as possible. And so operating under these paradigms allows us to be more efficient and allows us to really focus on member care rather than thinking about necessarily the number of visits that need to happen. And so we really like that. And you know, lastly, we found that it's financially beneficial to us. So if you can get the model right, it's really truly a win-win.
All right. What are some of the measurable impacts this model has had on efficiency, patient care, and payer satisfaction?
Sure. The way I think easiest to look at it is, like I said, we're in a bunch of regions across the country, some of which have a higher penetration of value-based care than others. But if we take our highest our region with the highest penetration of value-based care and compare it to our region with the lowest, we're seeing about 2 times the number of patients in a given clinic of equivalent size in the regions with high percentage of value-based care. So it really truly is allowing us to be more efficient. Of course, we want to make sure we're still delivering great outcomes. So we also constantly track outcomes and patient satisfaction. And what I can tell you is patient satisfaction numbers are pretty much equivalent across those 2 regions. So we're really seeing that we're not sacrificing quality at all to do that. And then in terms of how well we work with payers, you know, when we work with an organization, specifically when we work with HN1, we really feel a benefit on the administrative side because you all really understand what it takes to do this specific to our specialty. And that's really important to us. And, you know, I'll just give one example, credentialing timelines, one of the biggest administrative burdens on everybody that holds up patient care and gives everyone headaches. With Health Network One, we're seeing that credentialing timelines are about 3 times as fast as when we work with individual Medicaid and Medicare plans. So we're really feeling it on the admin side as well.
Thanks. Next question. Assuming you work with other value-based care organizations, how would you rate your interactions with Health Network One in relation to similar organizations?
I would say Health Network One is really at the top for us. And what I think it really comes down to is the focus on the specialty and understanding our specialty. When most of the other value-based care arrangements we're working with are typically either directly with a plan or with kind of a organization that does it at a broader level. And they tend to be one-size-fits-all approaches to value-based care. And as PTOT being a bit of a niche specialty, they're often not designed for us with us in mind. And so that creates, you know, kind of a round peg in a square hole situation where we're trying to adapt to something that doesn't necessarily make sense for our industry. So when we work with HN1, it's been great because everything is really custom designed specifically for the PT industry.
Thanks, Tom. Last question. How would you sum up your experiences with delivering a value-based care model in your specialty, and what are the key lessons or advice you'd offer to our listeners today?
Yeah. For us, it's been great. It's been truly a win-win. We've been able to be more efficient, see more patients, deliver more great care. And like I said, it's been financially beneficial for the organization. So it is something that we are looking to do more of, both inside Florida, outside Florida, across the country. So overall, great experience. From a lessons perspective, I would just reiterate that I think it's really helpful when the approach is specialty specific. And how the program is designed, it comes with the specialty in mind, and it's not a broader value-based care program. That's the thing that we've noticed has been the most effective.
Tom, thank you so much for sharing your expertise and your experience with all of us today.
Yeah, happy to.
Thanks so much, Tom. I'm going to reshare. And Kel, I will turn it over to you.
All right. So thanks again, Tom. Now I'd like to bring to life what we've just talked about through a case study. Chris is a 72-year-old member who had a shoulder injury after a fall. His physician recommends physical therapy and writes a prescription. Chris then visits an in-network outpatient therapy clinic like Cora Physical Therapy. When Chris visits the clinic, his therapist will use objective, standardized testing and screening tools to outline the frequency, intensity, and duration of service to determine the care plan. In the vast majority of cases, Health Network One and the provider will agree on the care plan and impairment level assignment. But if there's a question, we'll have a clinical peer-to-peer conversation and come to an agreement. This way, optimal plan of care will be put into place rather than the longest and most costly one. In addition to being better for health plans, it's better for members because it's likely to save them time and out-of-pocket costs. So now let's talk about the value-based impact to health plans. Our value-based model delivers proven clinical cost savings of 10 to 20%. Savings are achieved by changing provider behavior rather than by cutting reimbursements and denying care. Therapy costs health plans in more ways than one. Beyond the medical spend, there's the administrative lift, such as credentialing, claims payment, and provider training. With a fully delegated partner such as Health Network One, the administrative burden is lifted off the health plan, further reducing costs by 10 to 15%. In total, plans can expect 15 to 30+% savings. With a therapy network already in place, implementation can be completed in as little as 90 days without member disruption. And we deliver future stability. While savings can be tremendous in the first year, value-based care can stop the upward trend in therapy PMPM, costs flatten, access stays strong, members and providers have a better experience. Marty, can you share some suggestions on how to best shift from fee-for-service to value-based care?
Sure. Specialty care can be complex to manage, even if you have a lot of experience in value-based care. And this slide, though, provides you a little bit of information, some key factors that you should consider and evaluate. We recommend you first start by identifying where value-based care can make the biggest impact in your organization. We find that specialty disciplines can represent major additional opportunities for improvement, besides for the traditional value-based arrangements in primary care and large health systems that may already be in place in some manner. It's for the reasons we previously mentioned why therapy can be a great entry point for VBC in specialty care, especially since it's very measurable, scalable, and offers immediate opportunities for cost savings in both in a medical and an administrative cost standpoint. It also improves then immediately outcomes for your members. And while these implementation for this type of program can be complex, it doesn't have to be going alone on your end. You can partner with an experienced company such as HN1 who can navigate for you and help you look at what's entailed from regard to a credentialing, contracting, and overall operational implementation for it. This in turn also frees up your team's time to focus more on strategy and member engagement. KG, do you have anything else to add?
Well, first of all, I want to thank all of you for participating today. Hopefully, for the folks that are watching this, we have some Q&A, so we definitely want to jump into that. But we hope that this conversation has given everybody a new perspective on therapy as you're thinking about your specialty care, and also value-based, seeing it not as a cost center, but a value-driven asset that can really deliver lasting impact for your plan, providers, and members. I'm going to pull this up just so that you have it. This really is an opportunity for you to scan the QR code if you would like to see how we can help you implement value-based care in therapy or other products, meaning eye care, sleep, or dermatology. We'd love to do that. But I do want to jump into the Q&A because we have some great questions here. So first question would be, what would a value-based fee schedule look like compared to a fee for service? Tom or Marty, would you like to answer that?
Yes, I can answer that. A typical fee for service often has a reimbursement on a per visit basis, either pegged to the Medicare or Medicaid fee schedule or a fixed fee amount. In a value-based, we would have a bundled payment set up, and that payment would be escalated depending on the actual impairment level of the patient and for a certain time period. So depending if a person had a moderate impairment versus a extreme impairment, the reimbursement would be different. And that payment would be paid upfront upon the first encounter that the provider submits to us for the time period that that episode of care covers. The episode of care fixed payments are still pegged to the market local fee schedule for Medicare or Medicaid or what other providers are being reimbursed at to ensure that there's a fair reimbursement still being provided to the provider that performs utilization at not just at a very moderate approach. And again, if for providers that are good utilizers, that would often mean that there would be a higher reimbursement on average based upon Medicare, Medicaid allowable equivalent.
Great. And then one other question. Did you see an uptick in referrals to your therapy clinics? So this would be you, Tom, once you became established as a value-based provider, kind of like a center of excellence for other providers to refer to you.
Yeah, there's I think the short answer is yes. And I think there's kind of two reasons why. One, as I mentioned, we like to take all payers, and when you're working with referral sources, it's very helpful to be able to take all payers, so no one has to think about it, and they can just send to you, and they know that you're gonna accept the insurance. So that's certainly helpful. And then the second thing is, and I think this is an increasing trend, where especially on the primary care side, increasingly on the ortho side, they're concerned about the downstream costs for their patients, and whether that's because they're in value-based care arrangements on the other side, or just because they think they have to start thinking more about that. That's an increasing concern for them, and so we are seeing more of our referral sources be very interested in the type of care we provide in our experience with value-based care.
That's great. I'm going to stop sharing for just a moment and make sure that we don't have other questions. Just give me a second. All right, I see 2 or 3 more. First question. This would be probably for you, Tom, and then Marty would love your insight as well. What is the hardest part about transitioning to value-based care for specialists?
Yeah, I can jump in there. There's a number of hard parts, I would say, and I don't know which part is hardest, but I can touch on a couple. One is the technology and operations. So really, we're in a it would be one thing if all of your patients were under a value-based care arrangement, but the really challenging scenarios where some are and some aren't. And it's really helpful to understand which are and which aren't. And so to set up your technology and operation system to understand when a patient walks in the door, what sort of paradigm are you under? And so I think setting up your technology and operations to be able to do that is a challenge. And then, training your clinicians and helping them understand why you're shifting the way they've practiced in sometimes years. And so there is a cultural shift that needs to go on. So it's not a thing that you can necessarily do overnight, unfortunately, but something that you can build to over time.
That's great. And this question kind of is in line with that. So I'm going to ask it with your answer is, one promise of value-based care is less administrative burden and fairer compensation, Tom, for your providers. Is that actually how it's playing out in practice?
I would say the arrangements where we're in value-based care tend, for the most part, to be less administratively burdensome than those where we're in fee-for-service. Like I said, when you have a mix of the two, it can be a little tricky, and you need to have the right technology and operations to be able to handle that. But in general, on average, a value-based care arrangement tends to be a little less administratively burdened than a fee-for-service.
Great, thank you. And then I think this is our final double check after this, but Kel, could you share how outcomes are tracked in specialties like therapy?
That's a good question. Thanks. We've developed evidence-based tools which monitor a patient's care journey over time. And when you aggregate that information, you can look at providers, care plans, and efficiency over time as well.
Fantastic. Well, to all of you that sat with us for the last 42 minutes, we are so thankful that you joined us today. We hope that you learned a lot. To our partner, Cora Physical Therapy, thank you so much for your insight and sharing information on how value-based is actually used in practice within your provider facility. And if you have any questions, please feel free to reach out to us. I'll reshare briefly. And again, we appreciate your time. Thank you.
Thank you, everyone. Have a great afternoon.